Hello everyone, I am Dr. Parthasarathy, Senior Consultant Surgical Gastroenterology and Minimal Access Surgery at KIMS Hospital, Minister Road, Secunderabad. So today what we are trying to do is to collect and address some of the most common fears and doubts which our patients have at the time of discharge after they undergo a hernia operation, and we try to give answers to those questions. Let us see those questions. Almost all patients ask this question, should I be in bed rest, or they assume that they have to be in bed rest, and if yes, how many days should I be in complete bed rest after a hernia operation? So this is a myth that after any major operation one has to be in complete bed rest and should not move out of the bed. It's a myth and it does more harm. Bed rest actually does more harm than good to the patients. In fact, we strive very hard to achieve early mobilization of patients. Even on the same day of surgery, we make the patients get out of bed, get them walking. So what advantage this has is, when the patient starts walking, his breathing improves, the blood flow from the legs start flowing to the heart, and thereby the chance of any blood clot developing in the lower limbs, which is called as deep vein thrombosis, is less. The patient's intestines start functioning earlier, their appetite is returned earlier, and also it gives a lot of psychological strength to the patient to be able to recover faster. So one advice which I always tell my patients is, you do not need absolute bed rest. Of course, they should not be doing any strenuous exercise, but all patients after hernia operation, be it laparoscopic or open, should be encouraged to get out of bed as much as possible and move around. Absolute bed rest is no longer recommended for hernia operations. We give adequate pain relief in the form of painkillers when the patients go home, so that should take care of the pain factor, and they should encourage themselves to get out of bed and be on the move, and thereby they actually shorten their recovery time. So hernia is a problem which can afflict patients across the age groups, starting from young children to young fit adults to old people. So most of the young adults these days, the health conscious young adults, they are in the habit of regular exercise and going to the gym. And when they get a hernia, they get psychologically very demoralized, thinking that once they get a hernia and they undergo a surgery for hernia, they will no longer be able to go back to the gym and do those exercises. So this is a common question we face, that can I go to the gym after hernia operation, and if yes, when can I go? The general recovery time, first we will see for laparoscopic hernia repair, what is the recovery time. So for a laparoscopic groin hernia repair, patients can resume their day-to-day activities from the third day of surgery. Day-to-day activities meaning all their regular routines, like walking on flat surface or even climbing a few steps, using the toilet, getting out of bed on their own. These are all the daily activities. All this can be resumed from third day. In a week's time, they are fit to go out of the house, to even drive for short distances and go for outdoor walking. In a month's time, generally after 3 to 4 weeks, the patients are encouraged to resume their jogging or walking. We generally ask them not to start doing weight training exercises. From a period of 6 weeks onwards, patients can start doing more strenuous exercise, and from 3 months, fit young patients who have been used to weight training can go back to the gym and start doing weight training. For an uncomplicated inguinal laparoscopic hernia repair, by 3 months the patients can be absolutely back to their original routine of daily activities, exercises, be it cardio or weight training, and there is no major restriction in these activities after 3 months. They can do cycling, they can do all the outdoor exercises and activities and sports 3 months after the original operation. Now coming to open hernia operation, the recovery time might take slightly longer, but definitely patients are encouraged to start doing abdominal exercises 3 months from the time of surgery, because when the hernia is there, the abdominal muscles become weak, and after hernia repair, it is very important that these muscles regain their strength so that they get a very good success rate in the long term. Large abdominal hernias, when we do an open operation, we generally advise them not to go for heavy weightlifting exercises, but we encourage them to do abdominal strengthening exercises and cardio exercises. So by a time of 3 to 6 months, patients who have undergone large abdominal hernia repairs can resume their exercises, jogging and breathing exercises also. Another common practical question which we face from patients is, sir, I have only Indian toilet at home, can I use it? I have undergone a hernia surgery, is it safe to use an Indian toilet? The answer to this is yes. Squatting does not increase the chance of a hernia surgery failure. Indian toilet can be safely used by patients who have undergone hernia operation. Especially if the patient has undergone laparoscopic hernia repair, they are free to use both Indian and Western toilets. If the patient has undergone an open operation and for a very large hernia and the patient is overweight, during the initial phase of recovery, using an Indian toilet might be slightly difficult because of their inability to squat and to be able to get up from that position. So for the initial time, because of the pain factor, we advise them to use a Western toilet or get a custom made stool for passing motions. But once the pain decreases, and usually after 6 weeks of time, all patients who have undergone hernia operation can use Indian or Western toilet without any fear of developing any complications. But one thing which patients have to remember is they should not be straining at stools. So this is one advice we give to all patients. You must make sure that your fluid intake, fiber intake is adequate, and despite this, if patients have any problem of constipation, they should use a stool softener, which we generally recommend for a period of 6 to 8 weeks, so that during the healing time they do not strain too much at stools. The type of toilet generally is not a major concern, but having constipation and regular straining at stools might be harmful for a successful healing of a hernia. After hernia operation, what sort of diet is recommended for these patients? Are there any major restrictions in diet, or should they avoid certain foods to improve healing? So there are a lot of dietary myths among our patients when it comes to recovering from a surgery. So there are a lot of people who feel that they should not take certain types of pulses, they should not take certain non-veg, and there is a chance of infection if they take certain diets. There is no major dietary restriction after a hernia operation. The hernia operation is done on the abdominal wall, on the muscles of the abdomen. We generally do not touch or tackle the intestines or the digestive tract in a hernia operation. So we advise patients to take a very high protein diet, because we need the tissues to rebuild, we need the muscles to rebuild, we need a good recovery of the muscle strength after hernia operation. So they are advised to take high protein diet. For vegetarians, they are advised to take alternative sources of protein or even a protein supplement. There is no restriction on taking non-vegetarian diet or meat after a hernia operation. They must take adequate fiber, because after hernia it is always advisable not to have constipation. The stools have to be kept soft. So they should be encouraged to take adequate fiber and adequate fluids. There is as such no food item which is restricted or to be avoided after a hernia operation. Dietary advice may be different for a patient undergoing some other operation on the intestine, where we have specific dietary charts made for them. But as far as the hernia surgery is concerned, you need not worry, you are free to eat whatever you want to eat. Make sure you take adequate protein, adequate fiber and good amount of fluids. Many times even before the first operation, the patient's question is, sir, we will do the operation now, but how to prevent it from coming again? So it is definitely a very valid question. This fear is there in the mind of every patient who is undergoing a hernia operation, because the only thing a hernia patient is scared of is having a hernia come back again, or a recurrence where he have to undergo the entire process of undergoing another surgery and the tension along with it. So what are the advice generally we give patients to avoid a chance of recurrence? Number one, during the initial recovery phase, for the first 4 to 6 weeks, the patients must strictly adhere to our dietary advice, the advice regarding activities, what activities to restrict, avoiding heavy weightlifting. They must make sure that they take a good high protein diet which helps in a faster tissue healing. They must make an attempt to have high fiber, high fluid intake so that they do not end up straining at stools, especially during the initial part of the healing where the tissues are getting set, and that is a time where we do not want excessive straining. Smokers should avoid smoking completely after a hernia operation. Smoking is one of the major reasons why the hernia tissue which forms the hernia, the fibrous tissue or a cement, the body's cement, the quality of this cement is drastically affected by smoking. So whenever we see a hernia recurrence, usually many of them are smokers. So smokers have to completely stop smoking if they don't want their hernia repair to fail. Avoiding excess alcohol, trying to keep the body weight in check. So patient after surgery, if they start gaining a lot of weight, again the protein mass comes down, the muscle atrophy happens. Because of excessive stretching, the hernia can come back again. So these are the basic precautions one has to take to have a successful hernia repair in the long run. Good diet, adequate fluid intake, good care during the initial 6 weeks, complete avoidance of smoking and alcohol, and avoiding excessive weight gain.